Roxy and I'm Dr. Morwood, Surgery Coordinator. We want to help ensure you get the maximum benefit from your initial consultation. With Dr. Morwood's help, we will review some key elements to help you prepare for your first visit to our office.
I'm Dr. David Morwood. I have over 20 years experience in plastic surgery. One of the most important interactions that you will have with me is during that initial consultation. I think it's worth taking a few minutes to discuss how we can get the most out of this consultation for you. First of all, we are going to need to know your full medical history. We want to know what medical problems you have had. We want to know your medications, so it's great to bring a list if you take any medications. It's good for us to know your allergies. It's good for us to know what operations you've ever had. It's also very helpful for us to know if you have any special requirements or tolerances or intolerance to pain medications or narcotics, or if you have any special requirements in any way. We want to know your medical history so we can help you make informed, wise choices and good decisions. Second of all, I think it's very important that you have some familiarity and get to know me, if you can, even before coming in. Check out our website. My wonderful practice manager, Candace, has taken a considerable amount of time to make sure our website is really chock full of first-rate educational information. And many of the videos that we have linked to my website are my words, and what I see is the truth about plastic surgery, and our before and after photos, and we're linked to some seminars I put on, etc. So I think it's important, if possible, to get some familiarity with our approach, my work, how I think about plastic surgery, how I think about breast rejuvenation, how I think about facial rejuvenation, etc. If it's possible, come to one of our educational seminars that we run about every 6 weeks. They're free of charge, and they're not mandatory, but I think it's a good way for you to get an understanding how I approach this field that I so dearly love and this field that I'm very passionate about. Our seminars are called The Truth About Plastic Surgery, and we do one on eyelids and one on breast and one on facial rejuvenation and one for men, etc. If you can't attend one of the seminars live, many of them are taped and edited, and there are links on our website to those seminars. So it's great to have some idea, some familiarity with my approach before coming in. Now, what about when we sit down and talk and examine you about what you might want to change? What I recommend to people, as opposed to coming in and telling me what operation you want, is to come in and tell me what your concern is. Be able to take a mirror as we sit together and point out to me what you might want to change. Is it your lower eyelids? Do you feel your upper eyelids look tired? Is it your neck that maybe seems loose to you? Did you see a picture of yourself at an event or at a wedding and you don't like the look of something, or your profile? Bring in photos of what you like and what you don't like, and so we can talk about issues and I can help with a custom designed approach for you. Sometimes people, for example, look at the internet, they might read something, they'll see some of the websites, and they'll come in and they'll tell me, for example, for breast augmentation, they want a certain company, 365 cc's under the muscle with a axillary approach incision. That's maybe okay, but what I prefer is you come in and say something like, I want my breast to be bigger, fuller, and rounder, or I feel like my lower eyelids look tired, or I have loose tissue in this part of my face, and point to it. And then you and I can talk about what we can offer to you, and we can talk about realistic expectations, what it would take to accomplish your goals, what we can accomplish, what we can't accomplish, possible risks and complications, etc. So that's very important. Also, my patients find it very helpful, and I find it extremely helpful and fascinating and valuable for you to bring in photos of what you like and what you don't like, and bring in pictures. For example, if you want some facial rejuvenation, neck lift, eyelids, etc., bring in pictures of you from when you were a baby to your high school graduation picture to college to your 30s, 40s, 50s, etc. I find it very fascinating to study people's faces. You know, plastic surgeons study how people's faces change with time, and it will help us more custom design an approach that's best for you. Oftentimes when you come in for initial consultation, we will take photographs. We will certainly look at the photographs you bring in. We sit together and I look at your face while you look in the mirror, or we look at a certain body part. So I think it's great that you come in ready to describe what you want to change and ready for that part of your body to be examined. Oftentimes we will offer you the Vectra 6-camera 3-dimensional computer imager. That's a very valuable tool for patients to communicate with me about what they want. Most people never have an opportunity to look at yourself in 3 dimensions from different angles. So that can be a very valuable tool. So be prepared to talk about what you would like. Bring your complete medical history, medications, allergies. We want to know if you smoke or drink. We want to know if you require any special pain medicine or have certain requirements that we need to know. Keep in mind that we have a first-class educational center on our website that my wonderful practice manager has worked so hard on. And a special note for women who are considering breast reconstruction after a breast cancer diagnosis. We have published and produced a DVD, Breast Reconstruction, Know Your Options, a guide for the woman with breast cancer. It's hosted by Dina Eastwood. There's a free 10-minute summary online linked to our website. And many women find that very valuable because breast reconstruction is a really big field and we want you to be fully informed. So again, we want you to get the most out of your initial consultation. I think it's a very important part of our interaction. And of course, if you have any questions, if there's anything we can do to help you feel comfortable, please speak up.
Of course, we're here to help, so please let us know if you have any questions about how to best prepare for your consultation with our staff and Dr. Morwood.